started having chest pain several years ago, 5 or 6 years ago, but 4 years ago I can definitely trace back to a particular instance. Was told that it was nerves, it was anxiety, it was stress, and really couldn't get a doctor to treat it till I moved to Boston and got to the prenatal clinic at Dana-Farber. They sent me to a cardiologist who understands radiated chests, and I've been diagnosed with restrictive cardiomyopathy. There's not a whole lot that they can do. They can't make the heart work better, but they can give the heart less to do. Right now, the way we're treating it is with Lasix diuretics, but I'm a little bit of a challenge because my usual blood pressure is about 80/50, and the diuretics lower it, so they really don't have much of a place to go with me. They can't really go higher on the Lasix. The thing that we're kind of looking at now is, because they don't know how much is pericardial or how much is the heart muscle itself, is kind of making an incision somewhere in my abdomen and going in and actually looking at the pericardium from the outside. So that should be interesting. I kind of reached a self-esteem crisis over the last year, and part of it, or most of it, was being told for so many years that things were in my head. I started to believe it. I knew deep down that my symptoms were real, but when you're told for years and years that they're in your head and that you need Xanax and that it's anxiety, I started really questioning myself. I'd never been a really anxious person, but I was told it was all in my head, and I thought, well, who am I? Am I somebody who's started to invent problems? What's going on with me? And it really shattered my self-esteem. Also, I mean, when my doctor dropped me, it's the worst kind of breakup I've ever been through. I'm so bad that my doctor doesn't want me as a patient, when in reality she couldn't deal with the late effects. And then it's also really losing being a caregiver and being somebody that needs caregiving, and also just not being able to do so many of the things I used to do. I mean, we bought a house to fix up. When we bought it, I thought I'd be able to be pulling down wallpaper and painting and scraping, and I can't do any of that anymore. It's hard to know how to get the government or the policymakers to understand that cancer survivorship is a chronic condition, and I understand why they're probably afraid to do it, because there are a lot of us out there and they keep saving our lives, and then we have these problems that are essentially created by the treatment. I think they've just got to really look at concentrated numbers. Look at us as data points. Look at the fact that when I went to the prenatal clinic for which is my late effects clinic, for my very first appointment, and I said, oh, I've got this terrible fatigue. And they said, oh, we see that with Hodgkin's patients. I never knew that. I thought it was just me. Look at the trends, because they've got to put together these profiles, I think, and see what happens, and then realize that we are different. We fall under a category of people with chronic illnesses. And sometimes there are a bunch of little chronic illnesses that add up to a debilitating problem. My name is Janice D, and I'm a 27-year Hodgkin's disease survivor.